All right. So probably the best place to start when talking about abnormal psychology is how is it defined? What do we mean when we say something is abnormal? And there's kind of three broad ways of thinking about it, okay? In the context of everyday viewing what's normal versus abnormal. And the first one is one I think that we all use. I haven't met anyone who hasn't used this method of understanding, but it's the egocentric perspective. The egocentric perspective on abnormality is anything that I would not do or experience is abnormal. Okay. So, for example, if I think it's not normal to have pancakes for dinner, then that's abnormal to me, where it may not be abnormal for someone else. By the way, I like pancakes any time of the day, but that's just an example that comes to mind. So, and this really, what hinders a lot of people in seeking mental health services, as we'll learn when we go through the history of mental illness, is that the egocentric perspective requires a person who is having difficulties to first admit to those difficulties and accept that that's part of who they are. And so it's a very common method we use throughout. The second one is social norms. Okay, and social norms is how within a community or within a um, uh, society abnormality is uh, expressed or seen. And an example of a very common Western um, example is emotions and mental illnesses, especially things like depression and anxiety, where, and this kind of goes on the gender lines, where still in our culture, it's getting better, but for both genders, there's a stigma of having a mental illness. Um, I don't know about you guys, but this month, well, last month, October was Breast Cancer Awareness Month, right? And saw all the pink shirts, and you see shirts where it says "I survived breast cancer," all of those kinds of things. I have not seen though anyone wearing a shirt that says "I have schizophrenia in remission" or "I'm surviving depression." Okay, because there's a stigma to the admission of those kinds of things. So that's an example of social norms. And then on another level is culture and how cultures view things like mental illnesses or abnormal um, behaviors. And probably a good example of this is when we get to um, ADHD, attention deficit hyperactivity disorder. We're going to talk about rates within different cultures. So, for example, and this will just be a quick example, ADHD is diagnosed around about 13% of kids here in the United States. However, if you go to a country that has a very similar education system like France, they have less than a 1.7% diagnosis rate of ADHD. And the reason why I bring up education system is because that's where most ADHD gets diagnosed because of a teacher's perception of their children and the view of the child and whether they can concentrate and those kinds of things. And so we got to ask, so why is there such a high difference between the United States versus France? And really, it comes to culture. In the United States, we use what's known as the medical model when diagnosing mental illnesses and treating mental illnesses. So it's all based on symptomology of the individual. and the person or the child in this case. And if the child has those symptoms, then we treat those symptoms like we would diabetes or heart disease or whatever, usually a medication and some lifestyle changes, those kinds of things. France does not use the medical model when it comes to diagnosis of mental illnesses and that. They use what's called a systems approach. Okay. So when a child in France starts to develop ADHD, they don't instantly diagnose the child. They go in and work with the parents and the parenting style and how the parents interact with the child. They work with the teacher on how the teacher is responding to the child in the classroom and all those kinds of things. So they work with the family and the system that the child exists in. And it's only when if the parenting changes and the uh, educational approaches that were changed don't work, then they will go and diagnose the child with ADHD. But what they find is that for most of the time, majority of the time, it's in their culture, correcting the parenting behavior and the classroom management behavior usually corrects the behaviors of the child, the attention issues and those kinds of things. So two different cultures, we have the same exact disorder, but because of the way the cultures approach those disorders, we have different outcomes. Okay. So that's kind of how, on a cultural level, we do it. In psychology, we try to be a little bit more objective in that we try to use statistics and measurement to determine what is abnormal versus normal. So um, this is what they call a bell curve. And if you want to imagine this bell curve, this line that is right here, that's the mean or the mean, okay, the average. So 50% of people are on this side under this bell curve, and 50% are on this side of the bell curve. Let's say, and what you do in, for example, clinical psychology is you study the outliers, and the outliers are in this little tail here that makes up about 5% of whatever you're measuring. Let's say we measured sadness to happiness, for an example. And so a clinical psychologist would come along and they would look at that 5% down here, what makes them sad, okay? And then a relatively new field in psychology, it barely started in 1999, called positive psychology. And positive psychology looks at people who excel. So this would be people who are extremely happy, who don't experience a lot of sadness. And what they want to know is what makes these individuals tick. What makes, for example, a high-performing athlete beyond their physical makeup. What is it different about them mentally than everyone else? And they do this in business. They do this in homes and those kinds of things. So this is one other way that the study of abnormality can be seen as. Now, the question does become is what's the difference between abnormal behaviors and mental illness? What's the difference between those two? Okay. Abnormal behaviors are things that we will all at some time in our life probably experience. Okay. So we're all going to experience sadness, worry, anxiety. There will be times where we're self-indulgent. There's times where we're delusional, where we think people are after us or saying bad things about us. I hope I showed that in the sensations and perceptions, we all hallucinate every day. because of the blind spot that's in our eye. Our brain fills that in with a hallucination. Okay. But we will all have some type of hallucination in our life. We'll talk about severe ones when we get to schizophrenia, and what can produce those. Okay. And yeah, well, I hope we all don't experience violence. We probably all will experience some form of violence or harm in some way. Okay. But just one of these abnormal behaviors doesn't necessarily make someone ill or would be considered quote unquote sick. Okay. So what's the difference between these behaviors and what we would consider a mental illness or psychological disorder? Okay. And I do need to stop my conversation right now and give the content warning. Okay. Please keep in mind that this lecture and this topic is academic in nature. We will debate things such as the use of drugs for treatment of disorders and uses of labels of someone with a disorder. We'll discuss symptoms of different disorders. These discussions are for academic and educational purposes only. No one should use this information to diagnose themselves or anyone else. And if you are currently being treated for a given disorder, you should not change the course of your treatment based on our discussion without consulting your care provider. Okay. I have to give that warning because whenever this topic comes up, I always get a few students asking, oh, well, I don't know if I have that now, or I think I have this disorder, and that's not the purpose of this lecture. So we should start, though, with talking about the difference between mental health and mental illness. And then we'll do a little bit of work on identity and loneliness and its influence on mental health. Okay. But when we think about a lot of things in our world, it's important to try and determine, is this a mental health issue or a mental illness issue? Because while they do influence each other, they are separate processes. Okay. So first, let's start with what is a mental illness or a mental disorder, and go from there. So this definition right here, this long-looking one right here, comes directly from the DSM, which is a Diagnostic and Statistical Manual of the American Psychiatric Society. And it's what clinicians and psychiatrists and psychologists use to give someone a billable diagnosis is what I would call it. But we can look at it with these bullet points here on the left. Okay. First, a mental disorder is a cluster of abnormal behavior. So if we go back to this list, the difference between just experiencing an abnormality and experiencing a mental illness is that behaviors become clustered together. So if you look at these little red check marks, sadness, irregular sleep, negative affect, depressed mood, repetitive behaviors, negative thoughts, potential self-harm, those behaviors clustered together is what defines major diagnoses of depression, especially major depression. Okay. So when we see these different behaviors together, then we become concerned. Okay, so that's the first part of mental, is it's a cluster of abnormal behaviors. Okay. And then they have to have 4 basic qualities. Okay. One, they need to be deviant, meaning that they're not a normal experience for you as an individual. Okay. And why is this important? It's because there are societies, there's certain cultures. There's one in the Mediterranean, I believe, if I remember right, that if you went and gave them a short test for depression, just a paper pencil thing in it, pretty much everyone in these villages would measure really high in depression, but they would never say that they're depressed. It's just the way their culture and the way they experience the world. Okay. So that's what we mean when we say it has to be, it should be deviant. It's not normal for the individual to be experiencing it. Obviously, the second thing is that it needs to be distressful, okay? Meaning that it has to be creating the individual some level of apprehension, some measure of guilt, and whatnot, and some level of there's just something wrong with me. Okay. And then the fourth one, which is also an important one, is that it's persistent over time. Okay. Um, and so an example of this is depression. I think it's something like 80 something percent of people will experience depression in their lifetime. Okay. But for 90% of those people, that depression will last about 90 days and then go away. Okay. When we go from what is something that is common for people to experience to diagnosing it medically, is that it persists over time. So the depression is more than 90 days, and it is consistent over time, meaning that a person with depression isn't just depressed on Monday and Friday. They're depressed Monday through Saturday, Sunday, Monday, Tuesday, Wednesday, all week. Okay. And then the last one, and the most important, is that it's maladaptive. Okay. And maladaptive means that the cluster of behaviors is interrupting the person's ability to do school, to do work, to have proper social relationships, to experience things like joy, and normal political, religious, and sexual activities for that individual. Okay. And that's in the other important part of the maladaptive is that the symptoms don't exist within just one particular context. Okay. So again, going back to a person with depression, they're just not depressed when they're at work. They should, if it is truly the disorder, they should be depressed at school, at home, at their church, when they go visit mom and dad. It's so that the symptoms follow them. They just are not present in one particular context. Okay. So the combination of these is really what then, at least in Western psychology, is what is defined as a mental disorder. Okay. So now, what's the difference though between mental disorders, illnesses, and mental health? Okay. And I like to use the analogy of physical health versus physical illness. Okay. Is just like physical health, a person can have poor mental health, but not necessarily have a mental illness. And like physical health, poor mental health does, though, increase the probability of developing a mental illness. So when I always like to use the diabetes as an example, okay? A person can have a very healthy lifestyle and still develop diabetes. Okay. They could also have a very poor lifestyle and not develop diabetes. But, and this is where this comes in, especially with things like type 2 diabetes, is that having an unhealthy food lifestyle does increase the probability of getting diabetes. So it doesn't guarantee it, but it increases the likelihood. Okay. So here we have in this little chart, we have the dimensions. We have biological, psychological, and social dimensions. And then we have on this axis physical health, mental health. So on the biological level, of good person with good physical health eats a healthy diet, they exercise, and they abstain from toxins like alcohol or drugs. Okay. Someone with a strong mental health has, again, a healthy diet. They exercise, especially brain exercises and mental capacity exercises, and also abstain from the use of toxins because that can, again, influence our mental health. On the psychological level, for physical health, healthy people tend to have a growth mindset, a healthy self-esteem, and healthy self-efficacy. Okay. The difference between self-esteem and self-efficacy is self-esteem is this general notion of, do I like who I am or not? Self-efficacy is my belief in being able to accomplish something. So it would be my belief that I'm going to exercise 3 days this week, and I'm capable of doing that. Okay. Versus someone with low self-efficacy that really kind of doubts whether they could do something like that or not. Okay. And again, with mental health on the psychological end, growth mindset, healthy self-esteem, self-efficacies, thought engaging activities, and a personality factor known as open-mindedness. We find that people who have an open mind, willing to take in new information and change information as something changed, tend to have better mental health than those who have what's called a closed mindset. Okay. And then on the social level, on the physical end, it's engaging in the social world and not avoiding engaging and not avoiding and engaging in preventative and regular medical care. Okay. On the mental health end, we find that having a good sense of identity and belonging, healthy, intimate, and social relationships, and again, engaging in preventative social activities and medical care as well. So this is kind of the difference between what we just described as mental illness versus what we describe when we're describing mental health. And this will become important when we talk, if we were to talk about things like school shootings, and every time there's a school shooting, there's this talk about um, um, uh, increasing mental health providers and whatnot, even though what we find is that most people who commit a mass shooting or a school shooting really have no history of a mental illness. They have very poor mental health, but only a few would meet the diagnoses for mental illness. And it's important to kind of keep these things in mind as we navigate this world of increase in school shootings and whatnot. So that's something important to think about. So, so we're going to end talking today about talking about the role of trauma when it comes to physical and mental health, because we're finding more and more and more, probably one of the greatest risk factors of developing a mental illness is, yes, poor mental health, but also the experience of trauma and how that trauma is responded, how how the person responds to traumatic events or trauma that they've experienced in their life. And so so this is going to kind of wrap up our general conversation. And then this Thursday, we'll get into a little bit of the history of the uh, treatment and understanding of mental illnesses. But it's important to kind of finish explanations of mental health by talking specifically about trauma. Okay. So in the literature, when we talk about a person's trauma response to trauma, we usually call this what we call post-traumatic response symptoms. Again, in Western psychology and Western medicine, we like to symptomize everything. So the definition of post-traumatic response symptoms occurs as a reaction to experiencing or witnessing a traumatic event. These symptoms can affect someone emotionally, psychologically, and physically functioning, and is often associated with the development of what's called post-traumatic stress disorder. Okay, so I'll give it. I want to give an example of witnessing versus experiencing because they can both have debilitating effects. Okay. If you're going in the field of mental health or social work, you probably have heard the term vicarious traumatization. That occurs when the professional starts to become traumatized by the continued talk about someone's trauma or their client's trauma. Okay. And so this commonly is in the field of mental health and social services misdiagnosed. I don't think diagnosed is a right word for it, but what professionals often experience is what you would consider burnout, experiencing, feeling like work isn't worth it. I'm tired of this job. I don't get joy out of it anymore, and whatnot. And commonly, it's it's um, it's mistaken for burnout when actually it's probably some form of vicarious traumatization, and it should be taken care of more of as a trauma than a motivational issue such as burnout. Okay, so that's an example of just witnessing trauma and how it can affect a person. And of course, we all know directly experiencing trauma can also create traumatic symptoms. Okay, so so some of the causes triggered by events such as accidents, natural disasters, abuse. We all know about combat PTSD. And we should talk a little bit about acute versus chronic trauma. Um, because when it comes to acute trauma, this is something like a car accident or a one-time assault. When we're talking about chronic trauma, this is something, for example, a child who experienced child abuse throughout their life. And those types of things are a domestic violence survivor, as an example, or a military person who has had lots of tours of duties. And so that can be considered chronic trauma. And when we get to the human development section, we'll talk about something called ACEs. And this is a measure of traumas that children go through. And we have found that the higher the number on an ACEs scale or a score is associated with the development of mental disorders in adulthood, social dysfunction, even things like poverty and employability. Okay, the larger the number of traumas, the more difficulties that a person tends to experience in their life. Now, that's not everybody. There's always those outliers, but that's what we call the common trend. Okay. Uh, the duration that trauma can affect is it can last for weeks, months, or even years if untreated. Okay. For most individuals, because we will all experience some type of traumas in our life, whether it's a car accident, loss of a loved one, stuff like that, family argument. Most will only last for a couple weeks, maybe a couple months. But we get really concerned when that trauma continues to affect that person's ability to function in the world and be successful and happy. Okay. So these are some, so we were talking about symptomology. And so these are some of the symptoms that we commonly see. So the emotional symptoms, we often see anxiety, depression, fear and helplessness, and guilt or shame. Psychological symptoms can include things like intrusive thoughts or flashbacks, nightmares, hypervigilance, difficulty concentrating. And then behavioral, we can see things like avoidance, irritability, aggression, substance use, social withdrawal. All of these are very common symptoms when somebody is having post-traumatic responses or trauma continuing after a traumatic event. Now, probably a common trauma that you probably heard of, especially in our Native American world, is something called historical trauma. Okay. And I kind of want to explain what this is. Um, Historical trauma refers to accumulative emotional and psychological wounds across generations caused by traumatic events experienced by a group. For Native Americans, this includes colonization, forced removal, cultural suppression, and systematic discrimination. Okay. And the often impacts are manifested in mental health issues, loss of cultural identity, social economical struggles, and whatnot. Okay. So I want to stop and just express a few things, and I think this is important to understand. Is there growing evidence that we do physically carry a historical trauma with us? The answer to that is evidence so far supports that. In fact, there was some recent genetic markers found within Native American communities that really genetically are part of a stress response. And so there's growing evidence that yes, you can actually measure this physically and how much it potentially could influence a person. The second thing is whenever I've given a talk on historical trauma, I usually always get a white European. It's usually a white European person who goes, Dr. Peterson, everybody in their history, whether you're white, you're black, you're Asian, Native American, you name it, everyone has historical trauma that has happened to them in the past. You think, white Europeans and the warring Europe continent was in constant war throughout the Middle Ages, they use as an example. The stories in the Bible are used as examples. Um, and they say, so why is it that certain communities seem to have, quote unquote, more issues with historical trauma than other groups? Okay. And this is the answer to that, is that unlike most other cultures where trauma was spread out over millennia, thousands and thousands of years, the trauma that occurred to Native Americans happened within 400 to 500 years, starting with the landing in South America. And so what makes Native American historical trauma a lot more significant is it happened in a condensed period of time. And so unlike other groups who have experienced trauma, again, that happened over thousands of years, but because of the intensity of the trauma that Native Americans went through in such a short period of time, that's what makes historical trauma a lot more significant among Native Americans than, say, uh, white Europeans or people from Africa or Asia. Okay, and so I would encourage you to put it in that context about the short period of time, and that's what and the intensity of the colonization and forced removal and those kinds of things. That's what makes this topic more significant for Native American communities. Okay. All right. So I'm going to kind of end here for today. Like I said, this Thursday, we will start to look at some of the historical aspects of the development of abnormality and mental illness, and we'll look at some different types of treatments that have been uh, done, such as banishment, witch hunts, something known as trephining, when we return this coming Thursday. But this is a kind of a good break point to for today.